Hello, everyone. I'm John Evans. Welcome to another episode of One-on-One. Our guest this week is Kody Kinsley, who grew up here in Wilmington in a family that could not afford health insurance. He developed a passion for health care early on. And as he grew older, he developed a passion for public service. After working in Washington, D.C. for two different administrations, Kody Kinsley came back here to North Carolina and became Health and Human Services Secretary. In that role, he not only helped North Carolina navigate COVID-19, but he also helped launch Medicaid expansion. And that's going to provide health care coverage for up to 600,000 people in this state. That brought his health insurance story full circle. And Kody Kinsley also accomplished several other firsts along the way. Secretary Kody Kinsley, welcome to the One-on-One with John Evans podcast, sir.
John, this is such a treat for me. It's great to be here. Thank you.
How much did your personal experience fuel your drive to change minds in the General Assembly about Medicaid expansion?
I think my partners at the General Assembly are in their roles because, like every public servant, I hope, they look at their community, they know their friends, they know their neighbors, and they want to try to make a difference. I think that growing up in North Carolina, being able to speak from personal experience about the challenges that we faced growing up, which are still many of the same challenges people face today, struck a chord with my friends in the General Assembly who needed to try to figure out a way to help people out. And I think that that was an important part of the conversation. But it wasn't just my experience. It was the experience of so many others. And I credit Governor Cooper, who built this massive non-traditional coalition of people to come forward to say, you know what, we need healthcare more than ever before. We heard from sheriffs and members in the law enforcement community who were seeing 80% of people in jails having a substance use disorder and say, we need healthcare and not handcuffs. We heard from businesses and the chambers of commerce all over the state who said, to have a productive workforce, we need a healthy workforce. And when 24% of the people that work in childcare don't have health insurance, and you need these people to be able to care for children and to care for to make it possible for those folks to go to work, that's more voices to the chorus of people who really said we have got to get this done, and Medicaid expansion just made a huge difference.
When was the first time, Secretary Kinsley, in that first 5 months, maybe before that May vote, that you had an inkling that, okay, there's enough people on board that this might actually happen?
Well, I think that the entire hope of Medicaid expansion was on the edge every single day up until the day that Governor Cooper said, we're going to let the budget become law and we're going to get this done. Governor Cooper has called this the jobs bill of the decade. It brings $8 billion into the state of North Carolina at no additional cost to the state taxpayer. It's a huge infusion of funding into healthcare, but also into all the businesses that need healthy workers. And when you have a deal that big and when you have so many pieces on the line, it's tenuous up until the last moment. And so we were working it constantly, constant conversations with the General Assembly, with legislators to help them understand the impact of this broader deal in their community so that they could have those conversations as well. But we got it done. And the great news is that we didn't just get it done, we're getting it done well. And we're only 2 months into expansion, having launched on December 1, and we are already more than halfway to what was a 2-year goal. We have nearly 350,000 people enrolled in coverage, and that's super exciting.
And I was going to say, that's my next question. Your office sent out an email this week showing nearly 350,000 people are covered already, and your goal was 600,000. As I looked at the numbers, though, I saw that more than half, about 54%, are 39 and younger. almost a third are 29 and younger. To confess to you, I would have thought that the numbers, instead of going this way, would have gone this way, with more 55 and older being the first to get in. Did the numbers surprise you as you looked at the demographics?
I wasn't particularly surprised. I was a bit more surprised actually by the older end of the spectrum, because folks that may have been in other jobs where it was more common to have access to health insurance, it's actually some of our younger folks that are working in the gig economy, who are working in small businesses that can't afford to offer their employees health insurance. Those are the people that out of the gate really stood to benefit. As I mentioned earlier, 24% of people that work in childcare don't have access to health insurance. We know from the studies that we did in advance of this that 80% of the people, 80% that will benefit from Medicaid expansion are in working families. By definition, the people who are going to be able to get health insurance through Medicaid expansion are people who made too much money to get Medicaid before. These are folks that are in that gap. They've been making more money than they can afford to get health insurance, and yet they've made too much money to get Medicaid, but they've made not enough money to afford health insurance through healthcare.gov. Closing that gap helps give them coverage. So I think that's a pretty exciting fact. And I think back to my own experience. My parents worked super hard. My mom worked waited tables when we first early on at Causeway Cafe on Wrightsville Beach. My dad built sets at the movie studio in Wilmington. They worked incredibly long days, incredibly long weeks. But when they got to the end of the month, there wasn't enough money left to pay for health insurance. It just wasn't an option. It wasn't available to us through the work that they did. And it wasn't available financially when they were also paying for housing and food and everything else that you need for a young family. And we used to go to the community health center downtown Wilmington and all of that. Medicaid expansion unlocks the potential for families like mine and so many more in North Carolina to be able to get access to that preventative health services that people need.
Okay, a little bit more than 2 years now since you've taken over there. Have you had the chance to sit back and think, wow, DHHS has 18,000 workers in it. Is that a wow, or is that a holy crap, I'm never going to meet them all before I get done here?
You know, I've had a lot of amazing opportunities to serve in large positions of public trust. Before coming home to North Carolina in 2018, I was the Chief Operating Officer, Chief Financial Officer of the U.S. Treasury. And I spent a little time at the White House. I worked at the U.S. Department of Health and Human Services. And it all goes back to one of my first jobs out of college in Western North Carolina was running operations for a large behavioral healthcare company. And I have been drawn to complex operational challenges that really try to bring together the best of public service with the needs of the people and how to achieve those goals. So it's really a privilege to work in this role, and now to be in this job where I get to feel like the work we do every day makes a difference for the people that we serve. And those are the people who, when I go back in time in the time machine of my mind, I think about there was someone in this job and there were our own neighbors and community members that were making a positive difference in my life as a child. I got all my childhood vaccinations at the New Hanover County Local Health Department. I remember my brother was born at the New Hanover County Regional Medical Center. Those experiences, the things that helped give us health from an early age were made possible because a lot of the programs that my department now runs. And so there's a pretty gratifying full circle opportunity. Everything we do every day is about how to make people's lives better, and that's great.
But if you had to count every one of them, it would take you decades to meet everyone that works in that office or under the umbrella of DHHS. Every
I get
one
a lot
of
of
them,
emails.
every one of them does
day.
something to improve lives every day, though, right?
That's right. I think a lot of people don't realize that our department has 33 operating divisions, as you mentioned, 18,000 staff, a budget of $38 billion. We do everything from helping people have an insurance card through Medicaid to processing vital records and supporting people when they get their birth certificates or other major life events. We also operate 12 hospitals. We serve 2,300 patients that have some of the most complex mental health needs in the state. And if those hospitals don't work, all the other hospitals can't work. We have emergency response. I was in Mocksville, North Carolina last week touring our emergency response hospitals that we deploy, a lot of which we use during COVID, among other times. So just this incredibly vast mission that touches the lives of every North Carolinian multiple times, whether they know it or not. And I think our team members get the gratification of knowing that they're making such a positive difference in people's lives.
As I was doing some research for our conversation today, I found out you made the AB honor roll as a senior at Laney High School in 2003. So congratulations for that. What did a young Kody want to do at that point in time in his life?
Well, thank you, John, for reminding me that it wasn't the all A honor roll. I appreciate you just poking me in the eye right out of the gate here.
Believe me, that's where I lived my high school career too. AB was fine. It was honor roll, and I was in good shape because of it, right?
I've been interested in health and healthcare for a long time. I remember taking Miss Lieberman's medical terminology and healthcare class at Laney High School when I was a student, and through that class, actually organized and helped run several blood drives at Laney High School. That's actually where my passion for donating blood first came. And it's another kind of fun full circle moment. Blood donations have been limited for gay and bisexual men. I donated blood for several years until I came out, and then I wasn't able to donate anymore. And I led a charge of HHS secretaries from across the country to call on the FDA to make that change, something that we achieved about a year ago. And that's been fun. But anyways, that wasn't your question. What did I want to do? I wanted to be a kid. I was just a kid. I was going to Jimbo's at 2 a.m. to have pancakes, and just growing up, and had parents that pushed me really hard to do well. They believed that education was the key to a brighter future, and so I doubled down on it and didn't make as many A's as I needed to, John.
Well, but they really instilled in you early on, as I've heard you in different interviews and read interviews that you've done. Your parents really instilled in you early on that you were going to go to college. You were going to take that next step in education after Laney High School, right?
It was never an option. I mean, I think my parents, like most parents, want their kids to have a better life than they have. And they believed that, and still believe, that education is a path to that. I remember standing in line at Ogden Elementary School for a PTA spaghetti dinner, and my parents were telling me, then as a rising first grader, that I would be going to college and someday, to which I, as the precocious rising first grader that I was, said, why do I need to go to college? And they said, well, it's not an option. You just need to go. And I was lucky to have the parents that I have that saw that opportunity for me and pushed me so hard.
When you got your bachelor's in 2007, then you got your master's at Cal Berkeley. Healthcare administration, was that going to be your goal? And when did public service and getting into public service and government, when did that get on your horizon?
Right out of college, I worked at a behavioral health company in Western North Carolina. The company had been created after a lot of changes to the state-funded behavioral health system, where it was essentially privatized. And I had the opportunity to lead operations for that organization, and I grew rapidly with that organization. I also learned that the General Assembly, the North Carolina General Assembly, played an important role in ensuring people had access to behavioral health care. And when I say behavioral health, I mean mental health and treating addiction. And from my own life experience, from my extended family members, I saw firsthand the impact of addiction in families, the impact of mental illness, and how important it is to support whole person health and mental health and well-being. But because of that first job, that first real big job, my first job was technically Piggly Wiggly in Castle Hayne, but my first other job was helped me realize the role that the government played in ensuring access to care. And so, because of that, I went to get a Master of Public Policy degree to understand, and public policy is really about how do we measure what works and how do we scale it and how do we implement it well. And so I had the chance to study at Berkeley, which had the best program in the country at the time, before then going to DC to do it. And I actually pivoted out of healthcare for a while, kind of went more into broad scale government operations because I'd done a lot of healthcare and I didn't want to get pigeonholed. I wanted to kind of eat from the buffet, if you will,
Right.
and get some different experiences, but inevitably came back to health because of my kind of early passions in the space.
I'm a big proponent of internships. I had one between the summer of my junior and senior year in college, and it cemented what I wanted to do. I had done radio before college, did college radio, but when I got an internship at a TV station and I could put pictures with the audio, I was like, that's what I want to do for my life. You had an internship about the same time in your college career that, if I'm not mistaken, really played a big role in where you wanted to go, correct?
It did, yeah. I was interning in a physician's office in Brevard, North Carolina. And I had the very good luck of having a physician who said, look, you can intern with me for the summer. I'm happy to have you, but you have got to do a rotation through our business office, because he said when he had graduated from medical school, he didn't know how to run a practice. He didn't understand any of that part of the work, and he wanted me to understand it. And that was really what hooked me on healthcare operations and healthcare administration. As I mentioned, I went on to run administration for a behavioral healthcare company. I saw that the complexities of healthcare billing, fighting with insurance companies, trying to help support patients through that process was so much of the complexity that our current healthcare system is really strained by. And still today, we've worked hard over the last decades to focus on improving quality and increasing access. Medicaid expansion helps with both of those things. And now we still have to work on costs. Medical debt is the number one leading cause of bankruptcy in our country. It burdens families in just unforeseeable ways. And that's one of the reasons why I'm so proud of the Medicaid expansion work, to give people the peace of mind that they can go to the emergency room and not be saddled with that debt. But that internship gave me the on the job experience, if you will, that definitely fueled a lot of my future.
You worked under two administrations in D.C. For those of us who have never been in public service that way, what is that like? When one administration comes in, is the possibility that you're not going to be there any longer? You want to keep serving, but are there changes possible? Give me an idea of life over two different administrations and maybe the complexities and the questions that can arise about a job in government.
So I'll give you the inside scoop. So the the federal government has thousands of senior positions that are appointed by the senior department officials and by the president. Usually between administration changes, several hundred of those are kept on between administrations to ensure a smooth transition. President Obama kept on hundreds of President Bush's appointees during the transition to his administration. But at the end of the Obama administration, President Trump, he did something similar, but kept on much fewer. He kept on 50, of which I was one, and I was the only one at the Treasury Department. And I was in a role that was very operational. It was a little bit less about setting policy and a little bit more about making the financial and the technical systems of the U.S. Treasury work. And that was an important responsibility to ensure stability during the transition, which is why I believe I stayed on. What I think it taught me was, and it was a very challenging time, was that there's often a lot of perceptions from the new people coming in, and that my approach is, you got to kind of push through those perceptions and build relationships and focus on the work and what you're trying to get done. And I think that that skill set is what also helped me and continues to help me in working with our General Assembly in North Carolina. We have a Democratic governor, we have a majority Republican General Assembly. But in the end, the people, they want us to all work together to figure out how to deliver for them what they want. And that's what we have to do, regardless of the party.
You've talked a lot about when you first joined DHHS, the pandemic then hit, and the intense work that your entire department did in the next couple of years. But I've always wanted to ask, and I didn't get the chance to ask Dr. Cohen. I did a podcast interview with her, but it was kind of early on in the process. Asking you, as someone who was helping to guide this state through that pandemic, as much as you can admit now, did it get frustrating at times? Is it still somewhat frustrating? Do you have to hold your tongue sometimes when these people are anti-vaxxers or don't want to get vaccinated or don't want to take the steps that the experts say will help save their lives? As someone on that front line, I know you have to be as kind and gentle as you possibly can, but I would imagine there's probably some times back there saying, come on, folks, do what you need to do to stay safe.
I think about this in a behavioral health context. People, during periods of time when there's a lot of uncertainty, when people are scared, it can be really hard to navigate those in a way that don't turn into kind of scream matches where people are scared, and just the frustrations that brew in home discussions, etc. And I think that COVID was this very traumatizing moment for all of us, where everybody was thrust into a period where we were learning. I like to remind folks, people were washing their bananas. Right? We were learning so much about the nature of this virus from a scientific perspective, as far as how it behaved, how it was transmitted, what the impacts were, how it could be treated. At the same time, our immune systems, it was novel to our immune systems. So our immune systems had no preparation for it, and preparing for a virus, trying to control a virus that your immune system is prepared for is different than controlling for a virus that your immune system is not prepared for. And just, and all that uncertainty and all that lack of knowledge and information and all that anxiety just kind of came together into this intense bubble where, temperatures got high. I mean, they got high for everybody. We, each member of our team, while trying to figure all these things out and give people the information and guide it through, we're also wrestling with the questions of, am I going to go home and infect my loved one with the virus because I have to be out and about doing the work that I'm doing because of the job that I'm in?
Right.
I mean, it's an immense amount of stress and pressure that everybody was under, and trying to balance that was and remains very hard. I believe that when we think about public health, the first word in that is public. And our responsibility to the public is to communicate with them about the issues in a way that everybody can understand, that's plain language, and to try to earn and maintain trust over time. It was a very trying time, and people were very focused. And I think we have plenty of room to regain as far as everyone understanding, what we're trying to do and what we're trying to accomplish still. But I'm really proud of how North Carolina did. We never exceeded the use of our hospital beds. I like to remind folks, there are about 10.5 million people in North Carolina. There's only 20,000 hospital beds. We all can't be sick at the same time.
Yeah.
Very few of us can be sick at the same time, honestly. And trying to manage that capacity issue while also trying to get PPE to North Carolina, to allocate vaccines that were coming in dribs and drabs from the federal government. I mean, it was it was managing an incredibly scarce environment that could lead to a lot of frustrations. And yet we still, we had a very fast vaccination rate relative to other states. We never exceeded the use of our hospital capacity. And so we fared very well, and our business economy did very well. Still lessons were learned, but I think we're better for it. And I will tell everybody the best thing that they can do for us to stay ahead of both COVID now and frankly other viruses is to get vaccinated. I hate that there are, and I understand the confusion, but vaccination is the most phenomenal public health and science discovery perhaps in the history. It's one of our most powerful public health tools. Basically gives your body the cheat sheet that it needs for a virus that it does not yet know. And I went to the New York County Health Department to get my childhood vaccines, as I mentioned. And, and I'm glad that I did because I didn't have measles, mumps, and rubella. And continuing to get vaccinated is such a powerful tool. And I hope folks really continue to consider the importance and value of that.
You had been with the department a couple of years when Dr. Cohen announced her departure. When you stood on that sidewalk on that January day and you put up your right hand, what was running through your mind? I know you had to say the words back and everything else, but standing on that sidewalk and taking over, what was going through your mind that day?
Well, we faced the two largest surges of COVID after I took over. Both the Delta wave had started, the Omicron wave would come shortly thereafter. We were seeing case volumes like never before. People were exhausted. They were tired of the public health measures. It was incredibly hard to maintain the public's focus on doing the things we needed to do at a time when we needed them to do it more than ever before. Vaccination rates were starting to slow. People's utilizations of treatment were and still are lower than they should be. Therapeutics are incredibly effective. People should get therapeutics. So what was going through my mind is I need to get back to work. I mean, I took my hand off that book and I came back inside on the Saturday and I started working again and we got through it. And so that there was that we did that to follow the law and then we got back on the Zoom call.
Didn't take much time to soak it in. You really had too much on your mind?
It was a lot. I mean, what was on my mind was making sure that we were going to carry North Carolina through this crisis and to save as many lives as possible through it.
This past December, Medicaid expansion happens, and there was an article about you. I think it was Axios Charlotte wrote an article, and they called you the Republicans' favorite Democrat. What kind of compliment was that for Kody Kinsley?
Well, I would have recommended a different headline. Like, I was hoping for like really nice guy, or kind public servant, or even like AB honor roll Kody, all of these. I am proud of the relationships that I have been able to build with Republicans and Democrats in the General Assembly. I think that, there are things that we disagree on without question. And there are issues that we will continue to disagree on. But I believe that we have to get stuff done. And we have to work with whoever we have to work with to advance whatever we can advance that's going to improve the health and well-being of the people of North Carolina. And I think that what we've been able to accomplish, Medicaid expansion, nearly $1 billion investment in behavioral health, an issue that's been a key part of me, a major restructuring of how we manage behavioral health in this state, huge investments in other parts of our Medicaid program, increasing behavioral health rates for providers for the first time in over a decade. I mean, we have had major accomplishments that have not been seen in a very long time in just the last year because of our partnership and our work with the General Assembly. And I think it's a reminder that, there's still a lot of opportunity if you're committed, if you work hard, if you build relationships, and you listen. There's common ground to be found, and that the people want us to find it.
What kind of a boss are you? I've read no meetings before 10 in the morning. You go to the gym every morning. Sometimes you bring your dog to the office. What's it like working with Kody Kinsley as the boss?
Well, the dog is right here under my desk, actually. So I'm surprised his tail hasn't made a cameo appearance. Um, so I couple of things. So one, I think that one of the greatest joys of public service is that you have the opportunity to steward an institution or an organization that was here long before I got here, and it'll be long here after I'm gone. The measure of my success will be, did I leave this place better than I found it? And so you can't own it. It's not yours. It's about how do you pay it forward and how do you make a positive difference. My greatest legacy will be, will my team continue with the vision and the strategies that I set forth for them? And the way that you ensure that sort of legacy is by getting them to believe that your vision is their own. And so it's about inspiring your team. It's about understanding what matters. It's about, helping them see the moment that we're in from a public service perspective and how to rise to those challenges that the people want us to fight for. And at the same time, I believe that I've got some of the most talented folks that I've ever worked with, and I've worked in a lot of really cool places. And that's because they care deeply about making North Carolina a better place. I am very serious about people taking care of themselves. One of my favorite things that we've done at the department is we have a line in our emails when we're away that, you have reached me, I am gone, but I will never receive your email because I don't believe in reading emails that came in while you were out of the office. But while I'm gone, here's the person that you can reach because the work goes on and we have to work in team. People need to go on vacation. They need to have work-life balance because I think we're stronger because of that. So I don't know. I hope that people would say that I am a fair but demanding person because we have an important group of people to satisfy, and that's the people of North Carolina.
But is it true, no meetings before 10 in the morning?
I try hard. I had one at 9 this morning. Part of that is a bit of a balance. If you don't carve out time to do the work, it's not that I'm not working. I was working it. Just to be clear to the viewers, listeners, I was emailing and working at 4 a.m. this morning before I went to the gym, which is probably not much earlier than you were up, John. But I think that what can often happen in roles like this, especially when a lot of folks want to see me, is that I can sit down at 8 a.m. and start meetings, and my meetings won't end until 8 p.m. and there'll be meetings every 15 minutes. You have got to be able to balance and prioritize. And so, if creating some standards around which you balance and prioritize allow you to actually get the work done.
You and your partner Angelo have been together now, if I'm correct, about 12 years. As the first openly gay cabinet secretary in North Carolina government, will you take it and you think back that a young man or a young woman who is gay didn't have that person that made it, that achieved it until Kody Kinsley did? So as you think about that, you're that role model. You're that person that somebody who before thought, I don't know if I can reach the pinnacle here. Somebody else has done it. How do you think about that when that crosses your mind?
Well, first, I worry about anybody who's hoping when I grow up, I want to be a bureaucrat. But I think that
fair point.
I'm kidding, of course. I would have never envisioned myself in this role. Sure, part of it was because there weren't a lot of gay people in public life when I was growing up, and or a lot of publicly gay people in public life, I should say, and that could have immediately made me feel like, and did make me feel like, this was something I had to keep secret about myself, or it was something that was out of reach. I've said this before, and I say it often, that being a gay man is a part of who I am. I don't think it's the most interesting part of who I am. Some people think it's my hair. Some people think it's my the fact that I've, first generation college student, or where I went to graduate school, or the jobs that I've had. But I do believe that we are better people when we can bring our whole selves to work and we can bring our whole selves into serving others. I also think that we do our jobs better at the department when we can shape our policies around the lived experience of others. One of our big goals of the department is trying to close the gap for maternal mortality. Black women in North Carolina die 2.5 times as often as white women in childbirth. Similar for Black infants, they die 2.5 times as often. That's horrible and that's tragic. I believe that the policies and the programs that we put in place to try to close that gap will be better informed by a Black woman who's given birth. That sort of lived experience, both working at the department and working with us to shape that work, is really critical. And I believe that there are a number of efforts in the gay community that I bring a particular insight to, that I think is important. So it's a real privilege to have been able to serve in so many roles of public trust, and now in this one. And it's really a privilege to have a governor who believes that diversity is our strength, and that when we can represent all of North Carolina, we will better serve all of North Carolina. And that's what we're trying to get done.
I think you're an inspiration to a lot of people. And I think a lot of folks would agree with me when I say that. When you do get a chance to get home, when you do come down I-40 and you park it here in the Wilmington area, what do you do? How do you detach? How do you disconnect? What do you do while you're here in town?
Well, so usually when I'm coming to Wilmington, it is for work, and I am well, let me say it this way. I'm glad to have the opportunity to get to Wilmington for work 1 or 2 times a month. And whenever I am there for work, in addition to seeing you and Francis, I always see my parents, and try to have some time with them, who still live in the Ogden area and in the house that I grew up in.
Nice.
And we, like to go out to lunch or dinner. Usually we'll find a place downtown. It's so fun to see how vibrant downtown Wilmington is now. It's so different than when I was there. I still go back to Circa. I remember going there when I was in high school. It was where I had my, 16th birthday party, was at Circa. It was like the special fancy place. Or we'll go to the Oceanic and go out to dinner. We'll go around Greenfield Lake and walk and do the loop. But I like to be outside. I like to hike. I like to walk around downtown area. And then the other way that I de-stress is I like to go to the movies. I do that in Wilmington or in Raleigh. It's a forced time off the phone, right? You can't have your phone in the meeting. See, I'm flipped up. And so the ability to just kind of be entertained and enjoy that is great. And that, look, I used to do that, going to see the movies all the time growing up too.
I heard you're a pretty voracious reader as well.
Yeah, I don't do that in Wilmington as much, but I read about a book a week. And I just finished Trust, which is a pretty interesting book. It was on Barack Obama's must-read list. I think it won the Pulitzer. But it is a book about books, and what it is really about is who tells your story and how is it told, and the importance of perspective, which I think the work that you do is also critical to that. How do you tell that story, and how do you see things from different angles?
Yeah. Well, I've had the pleasure and really the honor of interviewing a lot of thriller writers. I understand you're a thriller kind of guy as well. You like the thriller novels?
Yeah, I mean, I have a pretty wide array. I'll read, thrillers, fictions. I love true crimes. I don't know if you categorize it as a thriller, but I finished recently David Grann's The Wager, which I just think is this phenomenal story. Talk about kind of coastal, the Cape of Fear, the ships that the British sent around South America, and the shipwreck and piracy and all kinds of stuff. It's a fascinating true tale. And this is the author who wrote Killers of the Flower Moon. It's a really, really wonderful book.
This may be an unfair question, but I'm going to ask it anyway. You're zeroed in on DHHS. You're zeroed in on continuing to expand Medicaid. But as you look 5, 10, 15, 20 years down the road, what do you want to do? What is left for Kody Kinsley to accomplish? Running for office? Private sector again? More healthcare work? Where do you see yourself in 5 or 10 or 20 years?
As I kind of look back and think about my experience, I have had just a phenomenal opportunity to work in these positions that have such impact. I've had the gratification of seeing my work every day, even in the stressful moments and the complex moments, be able to make a difference in people's lives, and that's today. And we've got a lot of amazing stuff that we're working hard to deliver on. But I do know that public service is going to continue to be a part of my story. I mean, the passion that I have to make a difference in other people's lives is just innately who I am. And so I'm going to keep saying yes to opportunities that let me have the chance to do that.
When your last day at DHHS comes, whether it's 5 years, 10 years down the line, what would you want people to say? I know you touched on this a little bit before, but what would you want people to say about what Kody Kinsley's impact was on DHHS and on North Carolina?
Well, like any good person who answers questions, I'll give you 3 or so things. But I think, I came home to North Carolina in 2018 with a mission to improve mental health. And we've made significant progress, but there's still hundreds of people sitting in emergency departments waiting for care. There's kids that are languishing in all the wrong places. There's so much more that we need to do, and youth mental health is a big focus for me this year. But I hope that when I pass the baton, that there will be a note that the mental health system of care and the way that we treat people with addiction is one that recognizes these issues as not moral failings, but as diseases, where we have a healthcare system that can meet people wherever they are, that can prevent these illnesses and try to help give people treatment and recovery pathways that are so much more fair and humane. That's my real passion and mission here. I think Medicaid expansion for me is amazing and a wonderful part of my story, but it's also a tool by which I can get more people access to health insurance, to get them access to the treatment and care that they need to rise to the mental health challenges that we face. Because I believe that, we often say 1 in 5 people have a mental health issue. Well, 5 in 5 people have mental health. And I know of no family that doesn't know someone who has not been stricken with a mental illness issue or an addiction issue. And from everything around how we relate to one another, the society that we live in, the happiness that we have, mental health and resiliency is just foundational to everything. And so I believe if I can try to make a difference in improving that, then I will have made North Carolina a better place.
From Ogden Elementary School to the Laney High School AB Honor Roll to the top of the North Carolina Department of Health and Human Services, Secretary Kody Kinsley, I've really enjoyed our conversation today. I've been looking forward to this, to talk about the issues, but also to talk a little bit more about your life, your aspirations. Thanks for taking the time for being on the One-on-One with John Evans podcast. I've really enjoyed it.
Thank you, John. It's been my treat.
A big thank you to Wilmington native Health and Human Services Secretary Kody Kinsley for taking time out of his busy schedule to join us for this week's podcast interview. If you'd like to learn more about him and the goings-on inside his department, you can log on to ncdhhs.gov. And now before we go, I'd like to ask you a favor. Please follow or subscribe to the One-on-One with John Evans podcast on whatever app you use to listen to your favorite shows. And if you would be so kind, please leave us a rating or a review. We do care what you think about our interviews, and the more feedback we have from friends like you, the higher we'll be listed on all of the apps, the better chance we'll have of bringing in even more new listeners. I'm John Evans. Thanks so much for joining us for this episode of One-on-One.